Hi viewers, this is Vijay Lakshmi. In today's presentation, we are going to see on standard precautions. Standard precautions are meant to reduce the risk of transmission of bloodborne and unrecognized sources. They are the basic level of infection control precautions which are to be used as a minimum, especially when we are taking care of the patient. Let us move on to the definition. It's the group of practice of infection prevention and the control infectious agents based on the principle that all blood, body fluids, secretions, excretions, non-intact skin and mucous membranes may contain transmissible pathogen. So regardless of the patient diagnosis, the standard precaution has to be followed almost for all the patients. What are all the elements of standard precaution? The first and the foremost is the hand hygiene, personal protective equipment, needle stick injury and the sharps injury prevention, and then cleaning and disinfection, respiratory hygiene, safe injection practices. We'll see one by one. First is the hand hygiene. So we use hand hygiene regularly by hand rub. Also, we equally practice by hand wash. For both the cases, what is the recommendation from the World Health Organization? So almost all the patient near their bedside should have the hand rub, and most of the time we need to take 2 puffs of the solution into our palms and then do the hand rub for minimum 30 seconds. The solution would be with a component of chlorhexidine 2.5% and ethanol 70%. In case of hand wash, again we need to have a soap and water based kind of hand wash, where again we need to take 2 puffs of solution, and the duration is for minimum 60 seconds, that is for 1 full minute. In case of surgical hand wash, it is extended, the duration is extended from 3 minutes to 5 minutes. So the solution will be with the preparation of povidone and chlorhexidine based. What are all some of the 5 moments for hand hygiene that we need to keep it in our mind? So it should be like before touching a patient, or before cleaning or doing any aseptic procedure on the patient, or after being exposed to a body fluid, or after touching a patient, or after touching the patient environment. For all these, minimum required is hand hygiene. What are all the 7 steps of hand hygiene? Before we start with the step, we need to wet our hands under the running water and then take soap solution in the palm. Now we need to start with the scrubbing. The first step is palm to palm. Second step is palm over the dorsum on both the hands. Third step is interlacing, and fourth step is interlocking. Fifth step is thumbs of both the hands has to be done in a rotatory motion, and sixth step is the fingertips of both the hands against the opposite palm. And then finally we have to finish with wrist. Next element is personal protective equipment. So when we say personal protective equipment, we do have the sequence of how to put on, that is donning, how to remove, which is doffing. The sequence is different for donning and then doffing. In case of donning, the sequence starts with gown, second as mask or the respirator, third is goggles or face shield, and finally the sterile gloves has to be put on. When we are doing the doffing, it has to be followed with the sequence of removing the gloves first, and then goggles and face shield as next, and then followed by the gown, and then finally the mask or the respirator has to be removed. So, and finally, we need to do the hand washing. So the next element comes the cough etiquette. So when you notice in the picture, it says which is the correct method and the incorrect method. The correct method, whenever you're sneezing or coughing, it should be against the sleeves and it should not be using your hands, which is the incorrect way. Okay, so you can take a look at the picture where you can understand when we are sneezing freely in the air without the mask, what happens. You can see the amount, the millions and millions of organisms just going and mixing in the air in the environment. Okay, whereas when you are mask, then you are protecting yourself and then you are protecting the opposite person. Especially, it always reminds us the patient in the hospital setup. The next element comes the needle stick injury. So when we say needle stick injury, again, uh, what are all some of the um, basics? What can be accepted as a needle stick injury? Not only the sharp, but also exposure on a visibly on a splash also is included under the needle stick injury. However, we need to get treated the same way. Let us go in depth about the needle stick injury. Break in the skin by a sharp object, so which means by a hollow board or a solid board with a cutting needle or a broken glassware. Okay, so which is like a sharp object injury that is contaminated with blood, visibly the body fluids also. Or it can be bite from a patient with visible bleeding in the mouth that causes bleeding in the exposed worker. But this is in very rare case only, but this do occurs. Or it can be splash of the blood, visibly bloody fluid or other potentially infectious material to a mucous surface. It can be the lining layer of the mouth, nose or the eyes. And finally, a non-intact skin. Okay, so when it is exposed to blood, visibly the body fluid or other potentially infectious material, maybe through a broken skin, which may be a chapped skin or a cracked skin or an abrasion or an open wound, whichever is the mode. Now we'll see what are some of the no preventions, management, and precautions need to be followed in all these needle stick injuries. So, how are we going to prevent and manage? So, the management varies depending on the hospital policy, but however, the prevention, when we think about it, is correct disposal in appropriate container, that is the needle, and then do not make any attempt to recap, and also you need to dispose the syringe as a single unit, not the needle separately and the syringe. So one syringe is meant for single use and it has to be discarded as a disposable way. And then avoid overfilling of the sharp container, where that is one way where often the nurses especially they get the needle stick injury, or otherwise the housekeeping people, because when it is full, that is the water proof container is full, then what happens is again during the attempt of removing there are chances of having the needle stick injury. So as I said, the management will be like different depending on the policy of the hospital. But what is the common protocol is you need to immediately wash the affected side with the water. So what I mean is for the needle stick. So immediately wash, and then we need to report it to the chief nursing officer within 20 minutes of exposure. So that henceforth the scrutinization of whether the patient is an infected patient, that all can be done behind the screen. And then an incident report to the infection control officer has to be noted, and then afterwards the risk assessment will be done by the infection control officer and the blood bank officer, and the treatment will be depending on the type of whether the needle stick is from a blind injury no, from a non-infectious patient or a infectious patient. So it depends on the no prescription from them. If at all there is a splash of blood and or body fluids on a non-intact skin, then what are we supposed to do? Immediately wash the affected area with the soap and water, and do not use any disinfectant on the skin, because now it is no, it is like if supposing there is a open cut, okay, then again we need to be like, we should not be doing no attempt on any disinfectant, and then do not scrub or rub the area, do not squeeze or press the area, which is commonly any one of us do. And then in case of splash of blood or body fluids to eyes, then what are we supposed to do is immediately you need to know expose our eyes under the running water, and then we need to gently clean with the water. Okay, so especially the running water, or it may be from a saline. Okay, so what is the one important aspect we need to follow is the eyelid should be gently inverted. In case of splash of blood or bloody body fluids to mouth or nose, what are we supposed to do? So if it is for mouth, then immediately spit out the blood or the fluids, and then rinse the mouth with water several times. Okay, and do not again make any attempt to rinse it with disinfectant or something. Okay, so both for nose and as well as for the mouth. And in case of nose, again you need to encourage the person to blow the nose and then clean the affected area with the plain water. Okay. And then now coming to what is the estimated risk of getting these infections from a contaminated syringe or a needle. Okay, so the percentage says for hepatitis B it is 30% of chance where we can, the person who are having the needle stick from the contaminated person will have the chance of getting the infection, and then 3% in case of hepatitis C, and 0.3% in case of HIV. However, 0.3 is going to be the less percentage, but nothing has to be ignored. Supposing if a patient is exposed to a needle stick injury, okay, what is the prophylaxis need to be followed? So in case of hepatitis B, so give a single dose of hepatitis B immunoglobulin, that should be immediately within 48 hours of exposure, and that will be like preferably a good amount of treating a person if you are doing the shot of immunoglobulins on the patient within 48 hours. In case of hepatitis C, again, there is no a specific prophylaxis is given at the time of exposure, but their antibodies will be checked every 6 months, and then based on the report, the treatment regimen will be available according to the protocol of the hospital. And in case of HIV, again, antiretroviral therapy to be given as immediate post-exposure chemoprophylaxis, and then where again the patient has to be retested after completion of the prophylaxis, that is after 4 weeks. But remember, during the duration of exposing the person to the prophylaxis, especially to the antiretroviral therapy, will be very difficult for the patient to undergo because the side effects are huge. Okay, now what is the basic immunization for the staff, okay, is expected in terms of the health for the concerned health personnel. Okay, so depending on the department, the vaccination again varies. So irrespective of any person who is working in the hospital, all should have the influenza vaccination once, that should be for that year. And then in case he or she is a doctor or a nurse who is having direct contact with the patient. Okay, so whoever is in contact with the patient for that matter, for them again the vaccination what is compulsory is with hepatitis B. Okay, so which has to be with 0 dose, and then first dose with 1 month gap, and again no the second dose in the 6 months gap. And now after the pandemic attack, it is expected that vaccination of health personnel should be done with COVID-19. Okay, so COVID-19 vaccines also, that is either with the Covaxin or Covishield, whatever is available in the market, but definitely they have to be like treated with Covaxins. And for food handlers, they are supposed to have vaccination with typhoid and then hepatitis A, apart from hepatitis B vaccination. Now, next we'll see what is the spillage management. How are we going to treat the spills? Maybe a blood or a body fluid which is spilled on the floor. Okay, spill of the blood or other potentially infectious materials must be properly disposed, and then safe disinfection of blood and body fluid spills is required. Okay, so especially for the workers who are exposed to bloodborne pathogens. And also spillage kit is available almost in all the areas. Okay, and immediately the housekeeping staffs will clean the spills. Next comes what are all the type of disinfectants which regularly being used in the hospital. This again will be varying depending on the hospital policy. So also depending on the type of the area. So it may be for the critical care area it is different, and then maybe for CSSD and OT the disinfectant will be different. Again maybe it is for the floor, the instrument of a fogging or surface. What is the purpose? Again the disinfectants is going to be like defined different, and that is expected to be like immediately done following the spill. Okay. Okay, now coming to that is blood body spills. Okay, what are we supposed to do? So the for the blood body spills, so which is considered under is the sputum, the vomitus, the feces, urine, blood, or any kind of the specimens which is taken up for the laboratory tests. Okay, so all these are taken up as blood body spills. Okay, so which has to be treated with 1% sodium hypochlorite, and it has to be left for 30 minutes. Okay, and then it has to be treated. Henceforth the step remains how we are treating for the other common spills. Okay, the same way we need to follow. So what are we supposed to do? Spread the tissue paper or the newspaper or paper towels over the area, and then the person who is fiddling the spill has to wear a clean glove, and then only they have to touch, and then it has to be carefully discarded in the correct color coding, that is the yellow garbage bin. Okay, so then afterwards the area to be mopped first with wet and then with the dry mop. Next, we are going to see what is the element of isolation precaution says. So isolation means for airborne it is different, droplet it is different, and contact precautions is different. But in all these cases, we need to have a isolation room, which is definite for all the three cases. Okay, now we can see here for all the three cases, the isolation room is like where you're going to use a private room for patients that may no that may contaminate the environment. That is why they are kept in a separate private single room. Okay, so in case of airborne precautions, how the room supposed to be is like with a negative pressure, and which are the cases which has to be treated with isolation for airborne precautions or pulmonary tuberculosis, chickenpox, measles, herpes zoster, and other diseases which are transmitted by the airborne droplets. Okay, for all these cases, what are some of the important things as a precaution? First is cleaning the hand. Okay, so when are you supposed to clean the hand? Before entering the room and when you are coming immediately after the room. So both the time you need to wash your hands, clean your hands with a hand rub. Okay, and then the next is put on the fit tested N95 mask, a respirator. Okay, so which will give huge protection. Okay, so whenever you are entering the room, the person supposed to wear the respirator, and then they have to remove the respirator after they are exiting the room, and closing the door immediately is essentially required whenever you are coming out of the room. Never the room has to be kept open and then allowed to remain open. It should be always kept closed. For droplet isolation, again, the room category required is a single room, preferably, and which are all the cases can be treated under droplet is the influenza, the meningitis, the mumps, and the pertussis. Okay. Again, what are all the precautions for the droplet infection? And again, the first and the foremost would be like cleaning the hands, including before entering and whenever you're leaving the room. And then make sure their eyes, nose, and mouth are fully covered before you are entering the room. With the face shield and then with the goggles. Okay, and as soon as you are coming out of the room, remove the face protection. Okay, and then you need to discard at the door, and then you need to come out. So which is for the droplet isolation. So in case of contact precautions, again, what is expected, and the room category here again is preferably the private single room. Most of the time the diseases requiring this category is the methicillin resistant Staphylococcus aureus, the MRSA, the multi-drug resistant pathogens for especially for gram-negative, okay, and then Clostridium difficile. So these are all some of the things which is coming under the contact isolation. What are all again? So the precautions coming under this. So here again, cleaning their hands, including before entering and when they are leaving the room. And then what are some of the additional expectations is like putting on the gloves before entering the room and then discarding the gloves before you are exiting the room. Okay, so also you need to put on gown before you are entering the room, discard the gown before you are exiting the room. So both are equally essential. And then do not wear the same gown and gloves for the care of more than one person. So one person, only one requirement, one PPE. Okay, that is the gloves as well as the gown. Okay. Also, supposing if the reusable instruments are there, then you need to again clean by disinfecting. Okay, so with some detergents, some disinfecting agents. Say use dedicated or disposable equipment. Okay, so where you need to say, for example, in case of the stethoscope, where you need to wipe with the alcohol swab. And next comes the element as safe injection precautions. When we say safe, then we need to follow for injection as 3O mnemonic. 3O mnemonic, that is one needle, one syringe, only one time, which has to be like a slogan for the people who are using for the patient. Okay. So what is the other recommendations apart from usage of the syringe for safe injection practices? Use aseptic technique to avoid contamination of sterile injection equipment. Do not administer medications from a syringe to multiple patients even if the needle or cannula on the syringe is changed. Use fluid infusion and administration sets for only one patient and dispose appropriately after the thing is used. Do not administer the medications from single dose vials or ampoules to many patients in a combined form where it has to be like thinking that the leftover content can be used for some other patient. We should not encourage such practices. Okay, so we have seen all the elements in detail. So what are some of the risk areas which is considered? Almost all the patients who are supposed to be treated with the standard precaution, but what are some of the high risk areas where we need to have a watch is these like as OT, ICUs, that is the intensive care unit, the blood bank, the cath lab, the CSSD, the endoscopy and bronchoscopy. So any intensive care areas will be treated as high risk areas. Okay. And what is the the infection control practices which need to be practiced in all these high risk areas? Okay, so the standard precaution again, we can categorize it for high risk area, medium risk area, and then low risk area. So what we are seeing is for high risk area. For high risk area, again, the standard precautions all has to be followed with hand hygiene. Entry to the high risk area is restricted to the minimum essential, and then we should never encourage wearing the outside shoes, and then anyone entering should wear a mask and cap compulsory, and then equipment cleaning and disinfection should be according to the protocol, and cleaning the floor 4 times a day is compulsory, and then surface surveillance swab on every month by the microbiology department should be done for almost all high risk areas of OT, ICU, etc. And then terminal disinfection as and when is required we need to do by giving close attention. And then in order to prevent hospital acquired infection, follow the care bundles. Now, what are some of the things we need to follow for medium risk area and for low risk areas? So medium risk areas, which are the category will come under is the inpatient wards. So for high risk areas, we have seen all as the intensive care areas, whereas for medium, it is the inpatient wards. Okay. So number one is standard precautions need to be followed at the patient side, and then preloaded drugs to be used within 24 hours, after which it is supposed to be treated for discarding, and then it has to be treated it as waste. Cleaning the floor 4 times a day is mandatory, and then thorough washing should be done every week, and then surface surveillance swab should be done in case of any outbreak, and as well as the terminal disinfection is done as and when it is required. And then we need to follow the biomedical waste disposal, which is essential. Not only segregating, it has to be like removed at least in a day 3 times. Too much overloading of the biomedical waste is also not encouraged. Okay, and in case of low risk areas, that is again the areas of outpatient department, those are considered as the low risk area. Okay, what are the things supposed to be followed? Cleaning the floor once in a day is required. Thorough washing is done every week, and then terminal disinfection is done whenever it is required, and then biomedical waste disposal clearance should be done minimum of thrice a day, like how we are doing it in the inpatient department, because most of the time the waste generated will be more or less the same. Okay, so we have come to the end of the presentation. So this is the reference for you. Thank you for watching. Thank you once again.